For this part of the year, some of you trainees should be looking at patients right now because that's really the most important part of training. The first few years is just in preparation for the actual thing. We're not training you to become teachers, to teach the lessons we taught you in the early years of training. You're being trained to be professional carers. You'll be healthcare providers. So that means the most important part of training is the application of what we taught you. Not all of you will be researching on stuff, although we would want you to do research to improve the actual act of caring. But most of you will be providing care. And that's pretty much what the course or what the profession is all about. It actually started as an apprenticeship. And you go to a doctor, probably early 19th century. You learn the basics in school. The most important part of training is actually application. You work with the physician and you learn from that. And we kind of formalized it and make it more integrated in the educational system. And suddenly, you have clerkship, internship, and things like that, which is supposed to work as long as you're actually having experiences and actually as long as there are consultants who are spending a lot of time teaching you. So it's like a more structured kind of apprenticeship. Unfortunately, there are problems with that. Consultants sometimes are too busy with their practices and teaching doesn't pay much, so they're not there, which is another bad thing that's happening in today's world. But anyway, we won't go into that. That's not the topic. The thing right now is there's COVID and suddenly during your last 1 to 2 years of training, you're not exposed to patients, and that might be a big problem. Of course, I cannot solve COVID. That's not my kind of work. My field is people who will ultimately end up dying. So, well, maybe we can use your imagination. We'll go for imagination. And then once the problem is all gone, which might take several months or hopefully not several years, then you get to practice, even if you graduated and sworn your oath. I mean, medicine and healthcare giving and nursing is a lifelong learning process. Actually, the most important part of university training is learning how to self-study, how to develop in your profession, how to develop their craft. Most of the things you've learned would be outdated in less than 1 to 2 years. Some people say it's 6 months, and a lot of stuff you've learned or a lot of stuff we taught you needs revision. Okay, so the most important stuff is learning while you're practicing. Don't forget that. And don't get too engrossed with, the little trinkets and going abroad and getting freebies from the medical industry and then forgetting about reading and stuff. A lot of people are doing that, which is not good. So let's go to the case. Imagine mom or dad, one of your parents, is not feeling too well. You're worried because of this pandemic time and you're not sure whether this is COVID or not. And this is the time of year to also catch cough and cold. Of course, coronavirus is a cough and cold, so it's really difficult. I mean, even the medical community doesn't know what to do to figure things out easily, right? So you're kind of hoping, and that's a very human reaction. You're kind of hoping that mom or dad, whoever's sick, would fall along the category of just a common cough or cold, or a little bit of a flu. They'll feel bad, but then in a few days they'll feel better. And the other thing that's making you think that is because it's so hard to get out of the house. It's a lockdown and you're in quarantine. And even if you can get out of the house, it's so hard to access the healthcare system. Let's say you're in a country where it's the time of the pandemic, the hospitals in your community and around your community, or even if you travel like 3 or 4 hours, are swamped. And of course, that doesn't cover the travel or you get there and all the red tape you go in between. I mean, let's say it's that bad, or let's say it's difficult for your community and it's difficult for your family, and you've lost your job. You don't have money to spend, and people who ended up in the hospital ended up spending 200 grand or 300 grand or more just by getting admitted and getting on a ventilator a few days. Of course, you pray that it doesn't end there. You might not know that getting on a ventilator increases your chances of dying, one's chances of dying by much. I mean, you're a lay person, but the cost is huge, right? So you're worried. The first coping mechanism and the immediate way your brain tries to defend yourself. I mean, just thinking about it would freeze your brain up. So the first defense mechanism, the most common one, is to think that it's not going to happen. And there's a good chance that won't happen. Unfortunately, in 3 to 4 days, your parent who's sick is getting worse and worse. And suddenly, the bad thing is actually becoming more and more likely. Now you're worried. You probably called your family doctor or your general internist, asking the doctor what you should do. And of course, the family doctor and the internist probably has their clinic closed up. They cannot see a lot of people, and they cannot even make home visits, or they might attempt to. But whatever happened, the decision was it's becoming too bad, and the chances that it is really it, the rate of deterioration is so bad that it's probably better to just go ahead and go to the nearest hospital that's willing to take your parent in, and your parent got admitted. Now, before we proceed with the story, let's consider what's happening. What's happening is there's no time to think. You're swamped with a huge problem right away. Your parents are getting sick. You know about COVID. You know about your friends. You know about your relatives. You know people who died. You've seen it in the news. You're worried. And it's not just the COVID itself. You're worried about everything else that's attached to it. You might get COVID. You might get sick. Even the prospect of your other parent getting sick, it enters your brain. And then you start thinking about death and hospitalization and cost and death, which may happen to you also and the other parent. I mean, everything's just going inside your brain, all at once. And it's probably hard to understand how it feels like, Of course, you need to understand how it feels like if you're the general internist or the family doctor who's caring for them in the community. Ideally, if you're a great primary care provider, or let's say it's a child who has lung problems, suddenly develops respiratory problems due to COVID, you have to understand how it feels like. You cannot just deliver the information, give them the protocol, and not say anything to make them feel better or lessen the confusion, lessen the worry and the fear. I mean, that's part of your job, especially if that's how you treat them every time they come to the clinic. I mean, you've been taking care of this family for a long time, or this kid, together with the mom. You've been seeing them for a very long time since the kid was born. If you're a good pediatrician, then it's going to be very personal. I mean, you might even be the godparent of the kid, right? Or they might have invited you to their house. And so it's a very personal thing. And as a person, as a friend, as part of the family, and the original concept of a primary care provider, and you'll attempt to support them, help them out. They're confused. And then from the house all the way to the hospital, you're kind of going to help them out. And that's a very important thing. So during the process, you sort of help them think, because your brains, if all these things are happening all at once, I mean, you can't think straight. You just do, and you just go with the flow. No time to think about death, dying, and things like that. You call, they tell you to go here, you just go there, right? So you go to the hospital, the guard tells you to sit down, you just sit down, you get worried, you approach the house officer, the resident or the vet or the intern, they tell you this, wait, and then you wait. You're powerless. Yeah? This is not your house. You feel more helpless. You're dependent on the system. You don't know what's happening, and you don't have anything to offer your parent, or you don't have anything to offer your kid. The way the community perceives things, this is your solution. This is the only solution. The people here in this hospital is your only source of solution. The people who are telling you what to do to get to a hospital have the solution. You don't. So you're helpless. You're dependent. You're overly dependent, and you're scared. So calming them down helps them think better. Calming them down starts the coping process, anticipating the good things and bad things. Of course, the brain would probably not think about the bad thing at this point. But I would guess subconsciously things are starting to happen. If your brain is not all frozen up with fear and confusion and stuff, it's calmed down, then things are beginning to happen near your surface consciousness or subconsciously. And this is very important because for this story, the process is really fast. Once the family member got admitted, in less than a week, within 3 to 6 days, the spouse or the parent was intubated, or the kid was intubated, and the patient dies in less than 3 to 6 days. So you're looking at a death that's sudden, okay? Not as sudden as a car accident, although we can go into that some other time when we talk about managing really complex, complicated grief due to really sudden, violent deaths. That's not our topic right now. It's almost as sudden as that, because from the time you decided that it's really bad to the time the patient got intubated and the patient dies in the hospital, which is probably less than 1.5 to 2 weeks, everything's a blur, right? You probably didn't have time to just sit down and think about their values, think about life, think about what's happening, try to sort things out, use your belief system, your concept of existence, your concept of life, and why things are so. I mean, you're in shock. That's the condition you're in. You're in shock. So what are we talking about? Well, anticipation of death, preparation for the really bad thing that might happen. It's not there. You didn't have time. You only have 1.5 weeks, and during those 1.5 weeks, your mind and your emotions are preventing you from coping well. If you didn't anticipate and if you lack preparation, then what results is the severe shock, severe episode, lack of preparation, major crisis, psychological shock. for both you and the patient who's in the emergency room about to be intubated, about to be sedated. Maybe he's still awake 2 to 3 days before he died and is lying in the COVID ward or in the intensive care unit. He or she, the parent, cannot even talk to the family or even worse, the child. That's really bad. The child is alone and mom goes in and the mom is wearing some weird get up. You can barely see her mom's face and you're scared and you're worried, right? So a child who has really bad lung problems, or an adolescent or a teenager, even a teenager won't be resilient enough. Even if the teenager is more mature than the small child, even a teenager won't be resilient enough to handle it. So it's lack of anticipation and preparation for everyone. The patient who's about to die, the patient who's lying on the bed, about to be sedated, or the patient who's attached to a ventilator, alert enough or awake enough to think or consider what's happening to him, and the family member, especially the closest family member. Now, how do you address this? Well, you can address the confusion. It's so sudden, they're confused, they're worried. You can provide them with enough support. You can help them with the decision making. You can help them figure things out. Give them some sense of control when they're trying to maneuver this really complicated, confusing array of people to talk to and things to do and places to get to before you get to the actual hospital. You can kind of help them out. I mean, that's probably the job of any helpful relative. Unfortunately, the relative is probably at home and cannot get out because of the lockdown or the quarantine. That's the job of the family doctor. At least help them out. If you cannot go out because you too are unable to move about, use the phone, because you know the hospital system and the healthcare system much more than they do. You know about the COVID much more than they do. Nowadays, actually, with social media and internet and the news, you probably both know a lot about COVID. You can understand the more technical journals, but they know a lot and you know a lot, but they're wading through all the bad information without guidance. So you have to guide them, especially if they're so worried. You have to kind of help them out. Now, if they're in the emergency room and they're talking to another doctor, and the doctor is asking them all sorts of things and giving them all sorts of policies and protocols and procedures, scared and you're worried and now you're more confused. You have to think straight because you're being made to decide on certain things, and you're being made to do certain things. A phone call, or if you're the family doctor or primary care doctor, you helping them out. You call their phone, they give the phone to the other doctor, and you can explain things to them better because you know them personally for several years. And that's probably a good thing to do. If you want to be that kind of primary care provider, that kind of general pediatrician or general medical doctor or general practitioner or a family doctor, I suggest that you should be that kind. That's what ambulatory Peds, general pediatrics, and general medicine and family medicine is all about. And that's the reason why there was a resurgence a few decades ago along these lines, because this is an important part of the healthcare delivery system. And of course, people don't want to go into those things because, everyone wants to be a super specialist, stand up in front of the hotel stage and start delivering a very technical scientific lecture or whatnot. But, this is the very important part, is the underappreciated, very important component of the healthcare system. If you want to be that one, then for you to function well, you should be doing this. Or for you to do the job well, this is part of doing a good job. This is part of doing a good job. Okay, you're trying to understand, you're trying to empathize. You can support them, with the obvious stuff, like they're confused, they don't know what to do, but you want to go beyond that. They know you, you know them, and of course, you're also a person, you're also worried, you're also confused, but you have to try to understand them. You have to try to understand yourself. If you want to understand the patient, the family member, of course you want to understand yourself. And so what are the things that might be going through all your minds? Well, first of all, is there might be a sense of unreality. Any huge problem that occurs suddenly, there's this sense of unreality. Something happened that doesn't fit your expectations. You're at home, you're really trying to protect yourself, you're worried about COVID, but you're doing everything and you're thinking, if we do this right, then none of us will get sick, or if we do get sick, we'll be one of the many who will get better, and that it's not going to happen to us. Of course, you're worried, but you try not to think about it. And suddenly it happens. And that's not part of your expectations. You've avoided that thought for a very long time. You've never even considered it. So suddenly you're thrust in this world, which is so unreal. You're one of the few who's going to experience the possibility of a dying family member, or one of the few who's going to experience dying because of COVID. So with this sense of unreality. Now, of course, this has an impact on all sorts of things. Now, imagine this patient or this family member being made to decide on certain things, like, do you want feeding tube, do you want a ventilator, do you want DNR, do you want a CPR? And they're in this state of unreality. How is that going to happen? How is that going to work? First, you have to get them off the state of unreality. All these things are nice. That's like empowerment, informed decision making. But how can anyone in that state absorb the information well, think about the information, analyze the situation, come up with a decent decision based on their values, their value system, based on what they think the patient wants? How can they do that if they're in this state of shock and unreality? You should be aware that this is not a simple problem. Even worse than just asking them whether they want to go for the surgery for a gallbladder stone or not. I mean, that's informed decision making. And this is worse, right? So, I mean, that's the scenario for COVID, the things they've heard in the news before all these things happen, and the trip from the house to the hospital and what's happening inside the hospital. This is all a blur. It's a sense of unreality. When you're trying to get all these paperwork done, if you really want to do it right, then you don't want someone in that state deciding on the paper. From an ethical and legal standpoint, any ethicist and lawyer will tell you that's probably an invalid consent. If we really try to get to the bottom of it, the information wasn't absorbed, the decision wasn't well made, it's in a state of shock. Those are the big stuff for things to become valid. They should be able to think well, they should be able to absorb the information well, and aside from signing all the papers. Take home point, try to support them well enough, try to decrease the confusion, try to decrease the stress, the sense of being harassed by the situation and by the system, so that they can provide you with a decent decision. And another take home point is, just because you presented it well in a very logical manner, you don't have their emotional stuff. You don't have their shock. So don't get irritated and say, I can't understand this family member. I mean, it's so obvious. I mean, you just decide, this is the information. You have the basic stuff. I mean, I explained it well, and I sat down and I kind of asked them how they're feeling, and then brought the priest in. And after 6 hours, they still cannot come up with a decision, and we have to make a decision now. Well, it's not that easy. I mean, of course, you can easily figure it out, but you yourself are scared of going through COVID and being the one lying down in bed, or being the one looking at your parent having COVID who's about to die. You have to be very open to the idea of thinking about it, trying to figure out how you would react, trying to explore how people would react. I mean, that's the only way you can get some sense of understanding and empathy. I mean, understanding is one thing. I mean, you need understanding for empathy, and you're supposed to be compassionate. You cannot be compassionate without understanding and without empathy, right? So